Human papillomavirus, or HPV, is the most common sexually transmitted infection in the world. It is so common, in fact, that nearly every sexually active person will get it at some point in their lives. The vast majority of the time, HPV is completely harmless and goes away on its own without causing any health problems. However, certain types of the virus can cause genital warts or lead to cancer, most notably cervical cancer. Understanding HPV is crucial for every woman because knowledge empowers you to take control of your health through prevention, screening, and management. A diagnosis related to HPV is not a cause for panic or shame. It is a very common part of human life and one that modern medicine is well equipped to handle. The many types of human papillomavirus. HPV is not a single virus. It is a large family of more than 200 related viruses. Each virus in the family is given a number, which is its HPV type. These types are broadly categorized into two main groups based on the level of risk they pose. Low-risk HPV types are those that can cause warts on or around the genitals, anus, mouth, or throat. The two most common low-risk types are HPV-6 and HPV-11. These two types are responsible for about 90% of all cases of genital warts. It is important to know that low-risk types do not cause cancer. While genital warts can be emotionally distressing and physically uncomfortable, they are not life-threatening. High-risk HPV types are the types that can cause cancer. There are about 14 high-risk HPV types, but two of them are responsible for the majority of HPV-related cancers. These are HPV-16 and HPV-18. These two types alone cause approximately 70% of all cervical cancers. High-risk HPV can also lead to cancers of the vulva, vagina, anus, and oropharynx, which is the back of the throat. High-risk HPV infections usually do not have any visible symptoms, which is why regular screening is so critically important. How HPV is transmitted. HPV is spread very easily through intimate skin-to-skin contact. The primary mode of transmission is through vaginal, anal, or oral sex with someone who has the virus. However, unlike some other STIs, intercourse is not necessary for transmission to occur. The virus lives in the skin and mucous membranes and can be passed through direct genital-to-genital contact. It is possible, though less common, for the virus to be spread through hand-to-genital contact. Because the virus is so common and is spread through skin contact, condoms do not provide complete protection. While condoms do lower the risk of transmission and are essential for protecting against other STIs, they do not cover all the skin in the genital area that could potentially be infected. This is a key reason why vaccination is so strongly recommended as the primary method of prevention. It is also important to understand that a person can have HPV and pass it on to others without ever knowing they have it, as they may have no signs or symptoms. The clinical journey of an HPV infection. The clinical course of an HPV infection is usually short and uneventful. In over 90% of cases, a woman's immune system will successfully fight off and clear the virus on its own, typically within 1 to 2 years, with no long-term consequences. This process is called clearance, and it happens without any treatment. Most women who have an HPV infection will never know it. In the small percentage of cases where the immune system does not clear the virus, the infection can persist. A persistent infection with a high-risk HPV type is the primary risk factor for developing cancer. If a high-risk HPV infection persists in the cells of the cervix, it can cause those cells to change over time. These changes are initially mild, but if left undetected and untreated, they can progress over many years, sometimes a decade or more, from low-grade abnormalities to high-grade abnormalities, and eventually to cervical cancer. This slow progression is a window of opportunity, allowing for detection and treatment long before cancer develops. A persistent infection with a low-risk HPV type can lead to the development of genital warts. Warts can appear weeks, months, or even years after initial exposure to the virus. They may appear as a single wart or in clusters, and they can be flat or raised with a cauliflower-like appearance. Symptoms of HPV in women. Most HPV infections cause no symptoms at all. This is true for both low-risk and high-risk types. When low-risk HPV does cause symptoms, it manifests as genital warts. In women, these warts can appear on the vulva, in or around the vagina, on the cervix, or around the anus. They are typically painless but can sometimes cause itching, burning, or discomfort. High-risk HPV in its early stages does not cause any symptoms. There are no warning signs that you have a high-risk infection in your cervical cells. Symptoms only begin to appear if the persistent infection leads to the development of cancer. Symptoms of cervical cancer can include abnormal vaginal bleeding, such as bleeding after intercourse or between periods, unusual vaginal discharge, and pelvic pain. The complete lack of early symptoms is precisely why regular gynecological screening is a non-negotiable part of a woman's healthcare. Getting professional help, diagnosis and screening. Screening is the key to detecting HPV-related issues before they become serious. You should see your gynecologist or a general family doctor for regular checkups. The primary methods for cervical cancer screening are the Pap test and the HPV test. 1. The Pap test, also known as a Pap smear. This test looks for cellular changes on the cervix that could be caused by a persistent high-risk HPV infection. During a pelvic exam, your doctor uses a small brush to gently collect cells from your cervix. These cells are sent to a lab and examined under a microscope for any abnormalities. 2. The HPV test. This test specifically looks for the genetic material, or DNA, of high-risk HPV types in the cells of your cervix. The sample is collected in the same way as a Pap test, and often both tests can be done at the same time from the same sample. This is called co-testing. Screening guidelines can vary slightly by country, but generally recommend that women begin cervical cancer screening around age 21 or 25. If your screening results are abnormal, your doctor will recommend next steps. This may include more frequent monitoring or a procedure called a colposcopy. During a colposcopy, the doctor uses a special magnifying instrument to get a close-up look at your cervix. If any abnormal areas are seen, a small sample of tissue, called a biopsy, may be taken for further analysis. Genital warts are diagnosed through a simple visual inspection by your doctor. Treatment and management of HPV-related conditions. There is no treatment for the HPV virus itself. The treatment focuses on managing the health problems that HPV can cause. For genital warts, there are several treatment options. Your doctor can apply a prescription cream or solution in the office, or they can prescribe a cream for you to apply at home. Warts can also be removed physically through methods like cryotherapy, which is freezing them off, or surgical removal. The goal is to remove the visible warts, but this does not cure the underlying virus, so warts can sometimes return. For abnormal cervical cells caused by high-risk HPV, the goal of treatment is to remove the abnormal cells to prevent them from developing into cancer. The most common procedures are the loop electrosurgical excision procedure, or LEEP, and cryotherapy. In a LEEP, a thin low-voltage electrified wire loop is used to cut away the abnormal tissue. Both procedures are highly effective at preventing cervical cancer. After treatment, regular follow-up screening is essential. Rehabilitation, the path after an HPV diagnosis. Receiving an abnormal Pap test result or an HPV diagnosis can be stressful. The process of rehabilitation is about both medical follow-up and emotional well-being. Medically, rehabilitation means adhering to the follow-up plan recommended by your doctor. This might involve more frequent Pap and HPV tests to ensure the virus clears, or that any cellular changes are monitored and treated promptly. Emotionally, it is important to arm yourself with accurate information to combat anxiety. Understand that an HPV infection is normal and that your body is very likely to clear it. Talk to your doctor about any concerns you have. If you feel significant distress, speaking with a therapist or counselor can be very helpful. Remember that having HPV does not mean you have done anything wrong, nor does it define your sexual health or future relationships. When discussing HPV with a partner, it is helpful to approach it as a common health issue, explaining the facts calmly and clearly. Prevention, the power of the HPV vaccine. The most effective way to prevent HPV-related health problems is vaccination. The HPV vaccine is a safe and highly effective vaccine that protects against the HPV types that cause most genital warts and HPV-related cancers. The vaccine is recommended for preteens, both girls and boys, at age 11 or 12, so they are protected long before they are ever exposed to the virus. The vaccine is also recommended for everyone through age 26 if they were not adequately vaccinated when they were younger. It is given as a series of 2 or 3 shots. Even if you are already sexually active, the vaccine can still protect you from any HPV types you have not yet been exposed to. Vaccination is a powerful tool for cancer prevention. Using condoms consistently can lower your chances of getting HPV, but it does not provide full protection. The surest way to prevent infection is to get vaccinated and to continue with regular cervical cancer screening. Research and expert perspectives. Research into HPV is a vibrant and ongoing field. Scientists are working on developing next-generation vaccines that could protect against even more HPV types. There is also research into therapeutic treatments that could help the body clear persistent HPV infections. Medical experts universally advocate for vaccination and screening. Dr. Diane Harper, a professor and physician scientist who was a principal investigator in the clinical trials for the HPV vaccines, is a leading voice in the field. She has emphasized the incredible success of the vaccine, stating in interviews and articles that vaccination is fundamentally a cancer prevention strategy. Her work has helped solidify the understanding that preventing the infection prevents the development of cancer. The American College of Obstetricians and Gynecologists, or ACOG, provides clear guidance for women. In their practice bulletins, they state, cervical cancer is a preventable disease. The widespread implementation of cervical cytology screening programs has been associated with a significant reduction in the incidence of and mortality from cervical cancer. This expert consensus reinforces the life-saving importance of the Pap test. In books aimed at patient education, such as The Vagina Bible by Dr. Jen Gunter, the message is one of empowerment through knowledge. Dr. Gunter works to destigmatize HPV, explaining that it is a normal part of life for sexually active people, and that the focus should be on the tools we have to prevent its consequences. The collective message from the medical and scientific community is one of optimism and control. HPV is a common virus, but with the powerful combination of vaccination, regular screening, and effective treatment for any abnormalities, the most serious consequences of HPV, especially cervical cancer, are almost entirely preventable.